So, Dr. Ayre, can you tell us a little bit about yourself and how you got to work so closely with those struggling with addiction?
Yes, thank you. Yeah, I'm Dr. Kieran Ayre. I've been working in the field of addiction and co-occurring disorders for the past 35 years. I'm a doctoral level clinician, and I have specialized advanced training in substance abuse and co-occurring disorders. So my career has spanned three different dimensions. I've worked for 35 years as a clinician, working directly with individuals and families that have been impacted by substance abuse and mental illness. I have been an academic teaching at a major R1 university, and I have been an administrator of large substance abuse and mental health programs. My life has been dedicated to working with those that have been touched or impacted in some way by substance abuse. And in addition to that, my own personal life has been touched and impacted by substance abuse disorder. And so I know the issues of substance abuse and co-occurring disorders from a number of different vantage points. One, in my own personal impact, of how substance abuse has touched my life. Two is, working for 3.5 decades, working with numerous clients that have numerous issues. And also from an academic perspective, understanding that there are different approaches and different techniques to help people with substance use disorder. So I think I'm in a unique place to help people, is that, my approach is very different than many other programs that generally offer a static or kind of a one-dimensional approach. Part of what it is that we do at Ayre Counseling is really tailor a program based on what type of issues the person is presenting with, and what their preferences are, and what they're going to respond best to as far as counseling and care.
Mhm. And can you tell us a bit more about your unique approach to treating addiction?
Yeah, so we are a boutique practice, and so we have a bespoke offering. We have 7 clinicians. I function as a principal of the practice, and we have 2 physicians, one of whom is a board-certified psychiatrist. And so many programs these days have static models. So for example, there are some IOP programs, intensive outpatient programs, which are really great and they help a lot of people, but they're cookie cutter. And we're very much different from that, in the sense that when people come in, some people come in and it's their first experience with treatment. And so we need to do a lot of education with them, and we need to try to help them understand what are the different options in terms of entering into a wellness or recovery path. Many of our patients have been through multiple treatments before, so we don't necessarily need to do some primary education with them. We need to try to help them navigate the particular issue or obstacle that is. And in very many cases, what that is that there's some type of co-occurring issue that either has not been diagnosed, it hasn't been properly treated in the past, or it's not under proper management. So that's where we're a little bit unique, in the sense that all under sort of one roof, we're handling and managing all of those aspects, as opposed to many substance abuse programs tend to kind of refer out for these other specialized things. So whether it's psychiatry, mental health care, family counseling, they'll say, hey, we'll do the substance abuse piece, but you got to receive those other services elsewhere. We do it all under one roof. The other thing is that many programs, and again, this is not sort of, bashing IOP programs, but many programs, really kind of have a very narrow focus in terms of helping the patient through the first 60 or 90 days of the recovery process. And they're working with patients to try to help them develop skills to abstain and to be sober. And so for many of our patients that we work with, is that abstinence is their desired pursuit. But we also have patients that they're not looking for abstinence. They're either trying to figure out if they have a problem. They're in more of a discernment process, and we're a great place for somebody to come and try to ascertain whether or not they have an issue. And for some other people is that they've decided that abstinence either is not their desired pursuit or it doesn't work for them. They've tried that in the past. So we have approaches that work toward moderation, containment, or what's called rules-based drinking. The other thing that we do that's a little bit different is that we tend to have a more protracted engagement with clients, and that provides us an opportunity to get into some of the deeper underlying psychological or systemic issues that led to their abuse of substances to begin with. And that's very different from IOP programs, which generally tend to sort of, again, work with people only for the first 60 or 90 days. We work in a longer term model with people. And so once they've achieved whatever their objective is regarding their substance abuse, then it sort of provides an opportunity for us to transition into different models of psychotherapy with the patient to address the underlying issues and causes.
Right, that's so important. You mentioned co-occurring disorders and how that can play a role in substance abuse. Can you talk a bit more about how substance abuse can affect mental health and how those co-occurring disorders also can affect substance abuse and the whole cycle?
Yeah, so there's sort of a saying in the treatment provider community is that substance abuse is the great mimicker of mental disorders, and so many patients present with a lot of different dimensions in their life that's out of control. And so part of our job is to try to quickly determine, are we dealing just with a substance use disorder, or are we dealing with a substance use disorder and some other axis one, which would be a primary psychiatric issue? Or are there other aspects of it, somebody's character or temperament or family condition is influencing their overall mental health? To answer your question more specifically, I mean, substance use disorders can have anywhere from a light impact on someone's mental health to a profound impact on someone's mental health. And so where we are, what our wheelhouse is we work a lot with people that are on the higher functioning end of the spectrum, right? So many substance abuse programs that are out there, specially structured group IOP and partial and rehab programs, they tend to work with people who have had profound impacts from their substance use. So, people who are homeless or people who have serious medical problems or people who have lost businesses and, failed marriages multiple times. And while we do see some of those patients, really what's more in our wheelhouse are people that are in a higher functioning band, right? So I'll give you a typical story is that we might see somebody who is a business executive, is very successful and very high achieving, but their substance use is really at a problematic level. And so they maybe go out into the community and they look for resources and they find groups where there are in IOP programs 30 or 40 patients, most of them court ordered, and people who are on a much more severe end of the impact spectrum in terms of substance abuse. So they feel sort of frustrated, right? Because they walk into those types of groups and they say, these are not my people. This is not really kind of what's going on for me. And so that's exactly the kind of ideal client for us is somebody that has a legitimate issue and needs help and wants help, but is on a higher functioning spectrum. So it's not to say that these people don't have issues and problems. They do. It's just the overall functionality in their life is higher. So in addition to the impact of substance abuse on the individual's mental health, I think the other area that we see a tremendous impact is on their relationship with their family. So people who have substance abuse disorder, and in many cases, another co-occurring psychiatric disorder like bipolar disorder or major depression or whatever, their relationships with their family have become very, very strained. And so that's the other thing that we do is that when patients come into care, we strongly encourage the family members to also participate in a course of companion care. And so they're receiving education and counseling, and we're working toward helping the family work through the issues that have occurred over the course of the mental illness and or the addiction, or to help them kind of come up with a plan, a strategy in terms of where they're going to go next.
Yeah. You mentioned that Your counseling is unique in the sense that they treat a lot of, high functioning addicts, professionals, lawyers, doctors, not necessarily those addicts that just are on the street really
Right.
struggling. What other specialty populations does their counseling work with?
Yeah, so just as you said that, I think what we're known for is, working with the high functioning addict and alcoholic. And so just as you kind of pointed out, is that many of those people are business executives, they're entrepreneurs. We have a specialty track for professionals. So we see doctors, surgeons, dentists, anesthesiologists. We see a lot of lawyers and other people who work within the judicial system. And we work with entrepreneurs and celebrities and athletes. But we also work with people who are, they're just an average everyday person who are looking for help, and, they want services. So you don't have to be a VIP to access our services, although we do see a number of them. So what we're known, our kind of our wheelhouse is substance abuse and co-occurring disorders. However, we do have other specialty offerings that are non-substance abuse related. So one of the programs that we have is called the Launchers Program, and it's really based on the failure to launch idea for 18 to 28-year-old young men and women who are not thriving, right? They don't necessarily have a substance abuse problem. They don't necessarily have a mental health problem, but just that they're not on the right life path. And so we have specialty services, including groups and specialized counseling and specialized approach toward helping those individuals right the ship and get on the appropriate life path. So an example of that would be a 19-year-old young man that has gone away to college, is certainly capable of doing good things, and ends up coming home and kind of saying, I'm not sure I want to go back to college. And the parents are frustrated. They don't know why the person's not on the right track. And so they'll seek us out, and we'll do a deep assessment, try to understand what's going on, and develop a tailored and individualized program to sort of help address that issue. And so that could involve individual counseling sessions, family counseling sessions. We do have some specialty groups that we offer for that. And we also have psychiatric services. So if there is an emerging or an undiagnosed or prior unseen psychiatric issue that's emerging, we can address that, and we can treat that with counseling and medication.
What advice can you give to people who are currently feeling hopeless or lost because of their addiction or a family member's addiction?
Yeah, so it's a great question. I think that sense of being lost, that sense of being hopeless, is very common for folks when they're caught in the struggles of active addiction, active substance use disorder, and even, active symptoms of mental illness. And so, reaching out for help, understanding that there are a lot of different ways to address things. So I think that's the thing that we offer folks, is the fact that many patients will say, hey, listen, I've gone to treatment before, and while I appreciate that AA, it works for some people, it doesn't work for me. So one of the things that we do is say, hey, listen, AA is a great program, and it's helped millions of folks, and it's certainly the granddaddy of self-help programs, but it doesn't work for everybody. Some people have objections to it, or some people just, they can't find a sync with it. So we practice from a lot of different kinds of models. And so if somebody doesn't like AA, well, there's half a dozen other major self-help programs that people can access. If somebody's not into a self-help program, then there are ways to work with people where it's not a 12-step facilitation or a self-help type of approach. So I think that knowing that there are other types of models, there are other types of approaches, that there is hope out there. There are people who are successful and really kind of doing okay in their life and have intact families and haven't ended up in jail 4 times, that there are approaches for it, that there are treatment options for those folks, and that many times they come through the door and say, my gosh, I didn't realize, the fact that something like this existed. I thought I had to go to AA, or I thought I had to go to, a traditional IOP program.
Yeah. Well, thank you very much for your time and for sharing the great work that you're doing. You offer a unique approach and just a unique demographic that people might not necessarily know about,
I agree.
know that
I
this help
agree.
exists for them. So I really appreciate you sharing this with us.
I agree. And, I think if this video speaks to someone and that, you kind of connect with the type of things that we're talking about, feel free to call me directly and I'm happy to discuss your case and see if we might be the right fit for you. So thank you for watching.
Okay, thank you very much for your time.